history. Humankind has prevailed in our darkest moments, coming together to face the very thing that would extinguish our light. This is not one of those moments at all. This is a moment for pretty much the opposite. For hiding, for laying low. Napping is also good. Saving humankind by really, really not getting near it. Where playing games, staring at screens, staring at anything, all are the stuff of heroes. Every generation has its moment, where individual sacrifice makes way for the good of those who will come after. A higher purpose. This one is ours.
Hi, my name is Mr. Benji, Cultural Ambassador and lead singer for TK International. COVID-19 has hit my livelihood very hard. No large crowds means no shows. No live performances means no zero. I want to get back to doing what I love, to what you love. Let's get back to 13. I can only get back on stage if we all take the vaccine. Get vaxxed. Mr. Benji said so.
I did not imagine that the prayers of my country would have been answered so swiftly.
Vaccine. Under COVID pressure in we country, mentally, socially, economically. Look, we get a blessing rather quickly to bring us back to some kind of normalcy. Yes, you over 18. Take the vaccine to protect your family. Take the vaccine to safeguard the elderly. Take the vaccine to bring back with festivals. Take the vaccine. Take the vaccine. Take it. Take the vaccine. Need it. Take the vaccine. Take it. Take the vaccine. Need it.
This is a message from Tasha P. and the Health Promotion Unit of the Ministry of Health, Dominica.
Hi, are you looking to be part of the COVID-19 battle? Are you tech savvy, own a mobile device and creative? If this sounds like you, here's your chance to win an attractive cash prize from the Ministry of Health, Wellness and New Health Investment in our COVID-19 short video competition. Simply create a video up to 1 minute long, encouraging your peers to get tested, get vaccinated, or just to promote the health and safety protocols. All video entries should be submitted to the Ministry of Health at our email address at healthp3@gmail.com and will consequently be uploaded to the Ministry's Facebook page. And then the competition begins. The video with the most likes and shares will win. Visit the Ministry of Health Facebook page for further details. Remember, we are all in this together.
Hey, Bernard, I see people sanitizing their hands before they enter your bus. Tell the people of Dominica, why have you enforced this?
My bus is my livelihood, and that's why I make sure all my passengers wear the mask and sanitize their hands to stop the spread of COVID-19. We all are in this together.
You have heard it here first. Let's all join the fight against COVID-19 in Dominica.
Throughout history, humankind has prevailed in our darkest moments, coming together to face the very thing that would extinguish our light. This is not one of those moments at all. This is a moment for pretty much the opposite. For hiding, for laying low. Napping is also good. Saving humankind by really, really not getting near it. Where playing games, staring at screens, staring at anything, all are the stuff of heroes. Every generation has its moment, where individual sacrifice makes way for the good of those who will come after. A higher purpose. This one is ours.
Hi, my name is Mr. Benji, cultural ambassador and lead singer for TK International. COVID-19 has hit my livelihood very hard. No large crowds means no shows. No live performances means no zero. I want to get back to doing what I love, to what you love. Let's get back to 13. I can only get back on stage if we all take the vaccine. Get vaxxed. Mr. Benji said so.
I did not imagine that the prayers of my country would have been answered so swiftly.
Vaccine. Under COVID pressure in we country, mentally, socially, economically. Look, we get a blessing rather quickly to bring us back to some kind of normalcy. Yes, you over 18, take the vaccine. To protect your family, take the vaccine. To safeguard the elderly, take the vaccine. To bring back with festivals, take the vaccine. Take the vaccine, take it, take the vaccine. Need it, take the vaccine, take it, take the vaccine. Need it.
This is a message from Tasha P. and the Health Promotion Unit of the Ministry of Health, Dominica.
Hi, are you looking to be part of the COVID-19 battle? Are you tech savvy, own a mobile device and creative? If this sounds like you, here's your chance to win an attractive cash prize from the Ministry of Health, Wellness and New Health Investment in our COVID-19 short video competition. Simply create a video up to 1 minute long, encouraging your peers to get tested, get vaccinated, or just to promote the health and safety protocols. All video entries should be submitted to the Ministry of Health at our email address at healthp3@gmail.com and will consequently be uploaded to the Ministry's Facebook page. And then the competition begins. The video with the most likes and shares will win. Visit the Ministry of Health's Facebook page for further details. Remember, we are all in this together.
Good evening to everyone listening and viewing via our various media platforms, and thank you for joining us for this August 24th COVID-19 press briefing. I would like to recognize our presenters this evening, Dr. Shaladin Ahmed, our national epidemiologist, Dr. Gilda Nesty, the coordinator at the Home Isolation Program, and Dr. Pearl James, nephrologist. On this evening's agenda, we will place emphasis on the COVID-19 situation in Dominica and the home isolation protocols. So to get this briefing started, I would like to welcome Dr. Ahmed.
Good evening to all. I have here with me Dr. Gilda Nesty, National Coordinator for Home Isolation Program, Dr. Paul James, nephrologist. So today's update, COVID-19 update in Dominica. As at August 24, 4 p.m., just to say that we still receiving more data for today, and it will go through a few more hours before we can collate and compile all the data. But as for 4 p.m. of August 24th, our total number of new cases as of yesterday, August 23rd, 2021, 100. Total active cases as at August 24, 2021, 4 p.m. would be 408 cases. Of these 408, PCR positive cases 11, rapid antigen positive cases 397. Total recovered cases 885. Total COVID associated death 1. Total number of people tested 42,527. Of these 42,527, 23,536 are PCR positive cases, PCR tested, and 18,991 were tested using the rapid antigen test kit. With this, our positivity rate is 3.3%. Now I'm going to share with you daily COVID cases. These are positive COVID cases starting from July 28 to August 23rd. The blue bar represents PCR positive cases, whereas orange bar represents rapid antigen positive cases. As you noticed in the beginning, we had both the PCR and antigen testing method. We did antigen test first, followed by confirmatory test or PCR testing. But from August 11, we stopped using PCR testing method. Those who are antigen positive, these were confirmed as a COVID-19 case. So as you can see, later part of this data of this graph, there were no PCR data. So the blue bar did not represent any blue bar after August 15 or so. As you noticed, total daily number of cases remain on average actually 80 per day for the last 6 days. So they remain a bit high. Now, distribution of the cases on the island. Most of the cases are positive cases that are from Roseau district. That represents over 77% of the cases. Then we have cases from Grand Bay, Portsmouth, just about 6% and 5% respectively. The lowest amount of cases were from Castle Bruce district, only 1%. Okay, I would like to share with you more information in terms of more details data. So these slides will represent subset of the national data that we have. This is one of the testing sites, the Windsor Park Stadium, that is. And this is one of the antigen testing sites. It is one of the largest testing site in Dominica right now. And data represents only who live and work in Roseau districts and its surroundings. It is a subset, as I mentioned. The data includes August 7 to August 20th, 2021. So this table summarizes of the cases that we are seeing. And these are by age groups. The representation, the total number of cases were seen between August 7 and August 20th were 5,160. This is a quite large number of large number representation, which is statistically significant. And of them, 440 were antigen positive. As you can see, they were stratified by age group, starting from less than 18 years. We had about 54 cases. Then 18 to 27 years, 84 cases. 28 to 37, 101 cases. 38 to 47, 62 cases. 48 to 57, 81 cases. And 58 to 67, 41 cases. So in terms of the age group representation of those positive cases, that mostly include ages of 57 and below. Anyone ages 57 and below, they were the most represented or affected by this COVID case. Those who are over 58 were very few and far between. So the positive cases now also disaggregated by those who are vaccinated and those who are unvaccinated. I'm going to just point directly to you that positive cases, of those positive cases, 444, only 23 were vaccinated, and 417 cases were unvaccinated. So as you can see, the percentage or percent of cases unvaccinated is 95%. So in summary, I just want to leave this information with you, is the daily number of new cases remain high, 80 cases on average for the last 6 days. Most of our cases are coming from Mosul Health District, which represents over 70% of the total cases. The PV-dominant age groups are adults and young adults. And vaccine works. It works against severe form of COVID disease as well as COVID transmission. Let me show you here how I come up with this COVID transmission, that it does work with COVID transmission. You notice that 23 positive cases out of 393 vaccinated individuals. So that gives 370 vaccinated individuals, or 94% were negative. So transmission rate in this cohort is only 6%. So this just data with my personal experience so far in this surge. I had been seeing and testing many cases, over 100 cases. Of that, I have personal experience with many families that some are vaccinated and some are not. Matter of fact, today I tested one family who actually the child was not vaccinated. The son is actually a young adult who was not vaccinated or is not vaccinated, and the mother was fully vaccinated, and they live in the same roof, breathe the same air, and living for past how many months together. And the son also symptomatic, so that means he also shedding the virus. And mother remain in this house and staying with son. So when we tested both of them, the only son became positive, but mother is not. Mother is negative. This is just one example for today. There were other examples that mother were tested subsequent period, and they were, in both instances, she was negative, and she was fully vaccinated in other instances. So with this, I have no doubt in my mind, and I am also a living example in terms of me being with positive cases, testing and being with them, and also testing myself periodically to notice if there is any growth or any virus in me, and they were all negative. So I am confident for myself and for my family and for all those who are vaccinated, is that vaccine works. I did not say they're always 100%. I did not say vaccine is a bulletproof, but vaccine works. Vaccine works for reducing the transmission. Vaccine works for reducing the severe disease form of this COVID. So I do appeal to the people, those who are still waiting and thinking to decide what to do with the vaccine. It's time to get vaxxed. Thank you for listening.
I want to thank Dr. Ahmed for such a detailed statistical report. As he said, as we heard, vaccinations work. So at this point, I would want to welcome Dr. Pearl James, the nephrologist at the Dominica, China Friendship Hospital.
And Dr. Ahmed, National Epidemiologist, Dr. Nista Tong, National Coordinator, Health Isolation Program, Communications Officer, Mrs. Vanel Oti, listening public, good evening. I am Dr. Pearl James, Consultant Nephrologist at the Dominica, China Friendship Hospital. The Ministry of Health confirms the passing of a 39-year-old female with pre-existing medical conditions. On August 12, 2021, the patient was admitted to the COVID-19 isolation unit at the Dominica, China Friendship Hospital after being found to be positive on the COVID-19 antigen testing as part of routine widespread testing of all patients seeking medical attention services at the hospital. On Monday, August 23, 2020, the patient passed away from hypovolemic shock secondary to perfused bleeding. With the goal of explicitly and accurately identifying deaths related to COVID-19, the ministry classifies COVID-19 related deaths in accordance with World Health Organization international guidelines for certification and classification coding of COVID-19 as cause of death. Upon consultation with PAHO, offices in Barbados and Washington, the death cannot be classified as COVID-19 related. The government of Dominica and the Ministry of Health, Wellness, and the New Health Investment extend deepest sympathies to her family and loved ones during this difficult time. I also wish to extend my personal condolences, as the deceased was also one of my patients. The ministry urges compassion and empathy at this time and calls on all citizens to respect the family's right to confidentiality and privacy as they mourn the passing of this loved one. The ministry is encouraging the public to remain vigilant and adhere to all public health protocols, recommending such as the use of masks, personal hygiene, physical distancing, sanitization of frequently used surfaces. Remember, let's all build our resilience in COVID-19. Get vaccinated, eat healthy, and stay active.
Thank you, Dr. James, and we join you in extending condolences to the family and friends of the deceased. At this point, we welcome Dr. Nesty, to give a presentation.
National Epidemiologist Dr. Ahmed, Specialist Nephrologist Dr. Pearl James, our Communications Officer Ms. Vernell Orley, the listening public, fellow Dominicans, good evening. Home isolation is a hot topic at this time. It is a privilege afforded to fully vaccinated, asymptomatic persons who have tested positive on a COVID-19 rapid antigen test. Due to their vaccination status and lack of symptoms, these persons are considered to be among our lowest risk patients. The protocols of home isolation, however, have to be strictly followed so as to reduce the morbidity and ultimately mortality rates. The COVID-19 home isolation protocol was carefully crafted by a team of experts and is guided by the science of this deadly virus. The request of the Ministry of Health and the Government of Dominica is simple. Together, we only ask that those who are allowed to isolate at home comply with the protocols given for home isolation. Patients placed on home isolation are given a red armband at the testing site where their positive status is confirmed. All persons who have received antigen positive test results from a testing site will be issued a card indicating that they are antigen positive and the date for armband removal. The card in my hand reflects the antigen positive card of Jane Doe. On this card, at each testing site, the date for armband removal is either written at the bottom of the card or at the back of the card. Persons discharged from the government quarantine facility in Portsmouth with a red armband and further instructions to quarantine at home will be given a discharge note with similar instructions. This red armband is to be secured and protected during the time period of isolation. As long as an individual remains asymptomatic while in isolation, the isolation period is set for a total of 10 days and the armband is removed on day 11. Armbands are not to be tampered with and are not to be removed prematurely. The red armband should only be removed by a health professional after the period of home isolation is completed. Persons are not to remove the bands themselves, and in the event that a patient chooses to venture out of home isolation with the band on, they will be fined. For patients who are placed on home isolation, it is expected that the medication and vitamins prescribed are used throughout the isolation period. These vitamins help boost your immune system and help expedite recovery. Vitamin C is considered an antioxidant and helps destroy the virus, specifically in the gastrointestinal tract. Vitamin D is important for healthy bones, teeth, and for muscles. It helps to regulate blood sugars, the heart, blood vessels, the lungs, and the airways. It has a role in boosting the immune system. These are areas affected by COVID-19. So giving vitamin D to a COVID-19 patient helps them to recover quickly and helps decrease the disease severity. Administering zinc supplements to COVID-19 patients with low levels of this element has been considered a strategy to reduce mortality and recovery time. Researchers and infectious disease specialists from the Hospital Del Mar Medical Research Institute have found that zinc helps prevent high-risk groups like the elderly from suffering the worst effects of the disease. Adequate hydration is also imperative as it helps in the detoxification process of the human body. Approximately 8 to 10 glasses of water, as well as a diet rich in fresh fruit, vegetables, and beans is highly recommended. Twice daily temperature checks should be done, and persons are expected to report their temperatures to the district health nurse. A COVID-19 district contact number is provided on the home isolation protocol leaflet, which is what I hold in my hand right here, at the bottom right-hand side of the card. Patients are asked to call in the COVID-19 district contact numbers and report their temperatures daily. If symptoms develop during home isolation, such as fever, cough, body aches, sore throat, vomiting, and diarrhea, persons are asked to call the district nurse using the COVID-19 district contact numbers or the hotline numbers and have their symptoms reported to the healthcare professionals. Clients allowed to home isolate must isolate themselves from others who live at their homes. This requires identifying a designated area which allows you as the patient to comfortably reside for the period of isolation. If sharing a home, it is recommended that persons consider using disposable utensils. However, if that is not possible, then utensils should be designated for the home isolated patient for personal use and washed separately with soap and water. It is preferred that persons who are home isolated use a separate bathroom. However, if that is not possible and facilities are shared, then regular cleaning and sanitizing of doorknobs and bathroom fixtures are encouraged, especially after use. All clothes and bed linen should be laundered separately with soap and water, of course. Other members of the family who reside in the home, although separated, are still encouraged to wear their mask in the home. Wash hands regularly with soap and water. The period of isolation, as mentioned before, is 10 days. Though this seems like a huge inconvenience to many, it is truly a small sacrifice for the greater good of our country of Dominica. On day 11, armbands are removed and persons are discharged from home isolation. We ask that persons who are home isolated contact their nearest health facility for instructions on armband removal on day 11. Though isolation is complete, persons are still asked to continue to practice the protocols for proper hand hygiene, mask wearing, and respiratory etiquette. Getting fully vaccinated also cannot be stressed enough, as that is the only way we can stop the development of new variants and the continued spread of this disease. The government of Dominica has made vaccines freely available at all major health centers across the island. Dedicated staff are always present to facilitate the vaccination process. The process is done efficiently and is smoothly executed. We therefore invite all of Dominica to help fight this pandemic and get vaccinated. Thank you.
Thank you, Dr. Nesty, for your presentation on home isolation protocols. To recap, as of today, August 24th, 2021, the current COVID-19 active cases on island remains at 408. I would like to encourage everyone to get tested, to go out and get vaccinated, and to follow all the health and safety protocols implemented by the government of Dominica. Remember, in order for us to get back to a state of normalcy, we all need to do our part in this global fight against COVID-19. Thank you for joining us. Good evening.